Hi, my name is Jeff Miles, and I'm going to be doing my NG tube video. So first we're going to look at our physician's orders, and we'll make sure everything is looking good. It looks like our patient, Kenneth Bronson, has a small bowel obstruction that has been causing him some nausea and vomiting for the past 3 days. So we're just going to insert an NG tube to relieve that pressure. So we'll check that off and go into the patient's room. Knock, knock, knock. Hand hygiene. Hi, Kenneth. My name's Jeff. I'm going to be your nurse today. I'm just going to verify your name and date of birth. So we'll look, and his name is Kenneth Bronson. Great. That's what we have in 105XX, 105XX. Perfect. So it looks like your provider has ordered an NG tube for you. Have you ever had that procedure before? And then we go ahead and explain the procedure. So what we're going to be doing is inserting a nasogastric tube in through your nose, and it's going to go down into your stomach. It sounds like you've been having some nausea and vomiting for the past 3 days because you have a small bowel obstruction. So we're going to hopefully remove all that pressure on the backside of that obstruction and relieve some of those symptoms of nausea and vomiting. So we'll connect that tube to this vacuum here, and it will place it on low intermittent suction, and so it'll be turning on and off and eventually decompress your stomach. How does that sound? Good? Okay, and then now that he has the general idea, I'll kind of give him the specifics before I get his consent. So this procedure is pretty uncomfortable. What we're going to be doing is putting, like I said, putting this tube down through your nose. It's going to go down your esophagus and into your stomach. When I first insert it, it's going to be a little uncomfortable. It'll probably trigger your gag reflex. I'll back it up, and then as we continue to advance it down, I'm going to have you sipping on this cup of water here. It might cause you to vomit. I'll set up a towel and an emesis basin in case that happens. But we'll try to get it down there. Once it's there, it'll be able to relieve some of your symptoms. But it will be kind of hard to do at the beginning. But we'll work together and get through it. How does that sound? Can I get your verbal consent? Great. So now that we have his consent, verbal and written, we're going to raise him to a working level and check for any contraindications. Those include seasonal allergies, bloody nose, esophageal varices, or recent skull fracture, as the NG tube would lead to increased intracranial pressure, and we do not want to do that. Now that we do that, I've explained the procedure and checked for contraindications, we can move on to the pre-procedure assessment. So we're going to ask him a few questions. Kenneth, when was the last time you had a bowel movement? Have you been passing any gas? Are you hungry? Have you had any nausea and vomiting? And then we're going to listen to his bowel tones and assess privacy. We're also bringing him up to a high Fowler's position, and he'll stay that way until the tube is removed. So we're going to listen to all 4 quadrants.
We are past our 15-minute mark on our vitals. We would obtain new vital loss.
Yeah, because it's not all the actual thing to write in vitals.
Yeah, I know. So,
And we'll, now we have that, we'll assess the patency of his NURS. We're going to check for a deviated septum or any other blockages. And we'll also assess the patency by having him blow out of each nostril. And the nostril with most airflow is probably the least obstructed, so we'll use that. And it looks like it's going to be the right NUR for this one. So next we will put on some clean gloves and get out our NG tube and get everything set up. So here's your towel and your emesis basin in case you do experience any vomiting. This is your water that I'll have you sip on later in the procedure. We're going to measure the tube to make sure it's going to go to the correct location. So we're going to measure from the nose to the ear, and then down to the xiphoid process. And there we go. We're going to put our first piece of tape there. So that'll give us where it should be placed. We'll lube the tube. Alright, so we have it all set up for you. Here, do you have any questions before we get started, Kenneth? No? So, like I said, we're going to insert it about 4 inches. It will probably hit your gag reflex, and then back it up, and then we'll tilt your head forward and have you sip on that water until we get it into your stomach. Sound good? Alright. So start with the head back, and here we go. So we insert it about 4 inches, aiming towards the eye. And once we hit the gag reflex, we'll take it back a little, have him grab the water, and then sip, 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 take a sip. Every time he takes a sip, we'll advance it a little further. We're going to just keep on going down. We're going to have his head forward. At this point, and then once we get it to our marker, we're going to put a medium piece of tape on to secure it there. We're going to check to make sure it's in the right spot by aspirating some of the gastric contents. We got some, so that's good. It's green, which is a good sign. We just want to make sure it's the right pH. It's going to be less than 5 if it's in the stomach, so take our pH strips. And got a drop on there, and we'll check it to the scale, and it is less than 5, so we are good to go. So now that we know that it's in the correct location, we can dispose of all of this properly, and we can put our last piece of tape on. We clean his nose with alcohol swab. Make sure this sticks as well as it can. This tape will just secure it so that there's no chance that this will come out. And then we can use the medium piece of tape to safety pin this to his gown, or use a clothespin, depending on the hospital's policy. So it's not tugging on him. Then we're going to set it up to some suctioning. We're going to start on continuous suctioning at 60 to 75 until it starts running. Once we see that it's running well, we can switch it to intermittent suctioning. We'll go ahead and do that. Make sure he's comfortable. Take off our gloves and dispose of them. How are you feeling? Kenneth, I know it's not a comfortable procedure, but we got it done, so now hopefully this will make you a little more comfortable. So make sure you clean up any vomit they might have had, any lube from the procedure. You can lower him back down. Make sure he's comfortable, has his call light. Is there anything else I can get for you, Kenneth? No? Alright, sounds good. Thanks for watching the NGT video.